We're looking at what happens when you don't get on in teams and people you work with. So, do you all know each other? No. Shall we do very, very quick introductions then, as we're a relatively small group? My name's Lynn, Lynn Marsland. I work for the Primary Care Providers Board, and I kind of lead on everything from HR, workforce, OD. But the good thing to say for all of you is that I'm actually a free resource. So I'm available. We're going to be talking about teams, but if we get to the stage when you think, you know, we could do with a bit of support in our team, then my time is completely free to you. So not that I'm trying to sell myself, but the offer is there. So, oh, somebody else joining us? Yeah. Oh, good heavens. Oh, I'm sorry, I'm your last resort. Oh, right, okay, great. So apparently someone's going to come and tell us when we're at the half hour. But so should we do some very quick introductions, just so as we know where you're from and who you are?
So I'll start with myself. I'm Ines Winnamede, I'm a GB in Oldham, GB trainer, interested in family planning.
Great.
And women's health. So.
Great, yeah. So you're a trainer as well?
Yeah.
Brilliant.
I'm a GP ST2 in Stockport.
Okay, so you're a completely different area then, yeah.
I'm Faisal, I'm a GP ST3 in Tameside area.
Okay, great, thanks Faisal. And you looked quite bemused when you joined us, so we'll be hopefully you're going to add some points for us. Should we go to the back?
I'm Becca, I'm a GP at Rochdale.
In Rochdale, did you say? Yeah. So are you relatively new to being GPing? Or?
3 years qualified, but
Oh, right.
year off
Oh, welcome back.
Hi, I'm Ben. I just finished my exams in school, but I'm here to have a look around to see.
Right. So it's all kind of emerging for you. Mm-hmm.
Discovering what I want to do.
Brilliant. Thank you.
I'm Emma, I'm a GP ST3 in Stockport.
Stockport as well. Okay, great. Thank you.
So I'm Tom, I'm a GP ST3 as well, but from Liverpool, working central Liverpool.
God, I can tell by my accent I'm a Scouse as well, you see. We always come in twos, although you're not a Scouse.
No, I'm actually from the southeast of England.
Yeah.
So, yeah.
Oh, you've seen the light.
I'll be up here, up for the weather. So.
Is that what it is? Whereabouts in Liverpool are you then?
So based like near Anfield Stadium.
Oh, never mind, I'm an Everton supporter. So.
We're quite close to there.
It is, yeah. Thank you.
Everton, actually.
Yeah. You hate Everton?
No, it is Everton.
Oh, God, you said you hate Everton. I was just about to say, you know, all these people, I'm pointing at the flip chart because I'm going to talk about, you know, how you get on with people, all these people that you don't like. Thank you. So, sorry. No, it's okay. You go now.
Yes, I'm SC3 Macclesfield.
Macclesfield, right. So it's all these quite spread around the areas, which is really good, isn't it? Because we'll get different insights, probably to the same problems. You're in Oldham as well. So somebody else from, you were from Oldham, weren't you? Yeah, great, thank you.
I'm Emily, I'm a GP ST3, I'm on the GM Deprivation.
We've just seen you. Yeah, very good.
And I'm working in Oldham at the moment.
Okay, so you're travelling around a bit as well, though?
Yes, we move around a fair bit, but right now I'm based in Oldham.
Okay, great. Hello.
Hi, I'm Dave. I've been around the block, but currently I'm a GP partner in North Manchester.
North Manchester, okay. Okay, thanks, Dave.
Hi, I'm Omid, I'm GPST3, Dr. Binamida's training.
Aha, great. Oh,
Oldham as well.
okay, gosh, so we've got a bit of an Oldham takeover, but we have got some other areas as well. So I work with Dr. Joanna Bircher. I don't know if you know Joanna, but she runs the GP Excellence programme, and we do a lot of work together on leadership development and team development. She obviously brings the really great clinical side of things. My experience is more lived. I've worked with the NHS for 30 years. I'm now actually retired, but came back to do this work with the board. And I was only thinking about GPs. I worked in the Scottish system for quite some time, which is a much more integrated system than we are here. But my very first experience of doing some development with GPs was up in the Highlands, where there'd been some issues around hospitals and bad publicity, really, between the GPs and the hospital setting. And there was a lot of the local cameras were coming in, the television, and these poor GPs were being interviewed left, right and centre, and they wanted to do a piece of work on political skills. And I just taught them through some of my experience, some of the training that I've done in transactional analysis. I don't know whether you've come across transactional analysis. Very basic, works, and one of the things that they said to me, which has always stayed with me, is that I did this when I was doing my medical training, but I didn't know I could use it outside of the surgery. And I thought, you've got all of these wonderful skills, but maybe you don't employ them outside of that. And that's always stuck with me. So we're going to start a little bit just thinking about, if you think about the team that you're in now, so when you're working together, some of you working together, hopefully you're thinking, it's a great team, but maybe it isn't always, or maybe you haven't always worked with a good team. To start with, just really to get people thinking, this is a very old model of team development, one that I like. You'll have seen the norming, storming, performing and what have you, but I actually prefer this because for me it gets into the meat a little bit more. It's called Cog's Ladder of Team Development. And what it talks about is that when you either join a team or when the team is new together, the first sort of phase that you go through is what's termed the polite phase. Oh, how are you? Do you live locally? And blah-de-blah-de. And usually from that, you start to find people that you think you'll get on with because you've got similar interests or whatever it might be. But also you've got that, so those of you who are familiar, for example, with Myers-Briggs type indicators, those sort of things, you may also think, they're a bit quiet. It's my job to bring them in. You're talking about extroversion and introversion, etc. So we start to form opinions about people at that stage. Very quickly, though, to enable the team to develop, we have to talk about, why are we here? What's the point in us being a team? Or I've just joined this new team. Why am I here? What's my role in all of that? Now, it kind of sounds a bit obvious when you think about a GP practice. Of course you know why you're there, because you've got a stream of patients to come in that you need to see. But then we've just been talking before about it's not just seeing the patients, it's being involved in the whole of their lives in some cases, potentially being the only stable thing that they've got in their life. And certainly when we do work with people who are new to maybe to the NHS or new to a surgery. I know you've kind of gone through your training, so you're not that new. But people say to us, particularly when I'm out with practices and they've been maybe HR type issues, it's we never discuss that. I'm part of the reception team. I'm nothing to do with the records team. Or I'm nothing to do with what the GP does. Or I'm part of the nursing team. And even just having that very basic discussion with people over a cup of coffee sometimes can make a tremendous difference, because it's, right, I see, I didn't quite get that. And that brings into play then, once there is clarity about where you fit into the team, what the team's doing, Cog called it bid for power. Now that's not, I'm going to be the leader now, I know where we're going. This is, again, I don't know if you're familiar with Belbin and team roles that Belbin, Dr. Meredith Belbin talked about. We all have a preferred role that we play in the team. We have a technical role, but we also have a preferred role. So it might be, I might have a preference for being someone who shapes things. So here's an idea, right, come on, I'll give me that, I'll get on with it, and I'll keep going. And you might say, yeah, that's a really good idea, however, we need to put this, that and that together because we need to make sure it's finisher. So you know, we would probably form a good role in the team. There's always someone in a team who likes to care for people, someone who never forgets the birthdays, someone who arranges a night out or brings in a cake, that kind of thing. But once people are comfortable with the role that they are, there's actually 7 or 8 roles in Melbourne, and we can all do 1 or 2. Once we're comfortable, so we know where we're going, I see exactly where I fit in now, this is my role, that's when COG would say that the team is actually starting to perform. It doesn't mean to say it's not doing anything while you're going through these phases, but this is where you go in of a morning and you think, yeah, okay, I've got loads to do today, but you know, I'll have a little natter and say hello to them, and I've got my work list or whatever it is I'm doing. And actually, I go home at the end of the day feeling like I've delivered something. Now, there's always going to be things that get in the way of that not being unrealistic. And what COG would then say is that the top of the ladder is what he called esprit de corps, where actually being part of that team is as important as the job that you do, because you get your motivation from there. You're on a par, you know, I need to spend a little bit of time with them because they're not too good at the moment, or someone will come and spend time with you because maybe you've been a little bit down. Is there a problem with getting there, do you think, to esprit de corps, or could there be? Yeah, we've got a problem once you're there, sorry, with being there, I should have said.
Right,
yeah.
So, I mean, obviously, you've got that camaraderie, that's fantastic, but then you might lose a little bit of the kind of speaking truth sometimes.
Yeah, not wanting to rock the boat.
You're going back to being quiet.
Yes, you can. I was just about to say, what happens when you introduce a new member of the team? You know, you're going back, oh, who is this? And are we still here for I didn't like being the starter last time, I want to do something else. But you're right, the esprit de corps can mask what's really going on. And it can also be that kind of thing where we get team think. Oh, we don't, that's not what we're here for as a team, we don't do that. Sorry.
So it might stifle some of that creativity or new
Absolutely.
ideas, or someone coming in might be seen as trying to throw everything off, and actually they could have something really valuable.
Yeah.
Yeah, so you get blind spots, don't you?
Absolutely, yeah, because you've got to there. So yeah, you might, because things change, not just people, but you know, the circumstances change.
Similar to what we've said already, that you might sort of lose that the team ends up becoming more important than the sort of the actual roles.
Absolutely.
Therefore, so like in the GP practice, it's about maintaining, make sure everyone's happy, becomes more important than after the patients.
Yeah, it can be. There's always a danger when you're around there. But I suppose people think that it's that is the area that you want to be ideally working in as a team. You know where you're going, you're comfortable, and you're able to perform. And sometimes it's absolutely brilliant. And they're the kind of times that get you through. I mean, you know, some of the situations that you have to deal with, the patients, etc. I don't know how you do it. But I'm just hoping that you've got people around you in the team who enable you to do that. So I'm just going to ask you now, where would you put yourself in your team at the moment on that ladder?
And it's interesting, we've got quite a lot of trainees here, and as a trainee, you're like stuck on the bottom ladder.
Do you because you keep moving,
because you're moving around, and you never. Well, even if you are someone who likes to be a creative thinker or to enact change or to drive change or whatever, you may be there for 6 months maximum, so you always feel like you're up to life.
Yeah. Yeah. You were going to say something, sorry.
I'm a trainee. I've worked my way up to the second rung, so I'm always on why are we here.
Oh, are you? And do you get, how so do you manage to get the answer?
No, I've been searching for it.
That wasn't the meaning of life, by the way. It was more about the team that you're in. Yeah. So do you actually ask that, or?
I think it's morale within. I think it's just morale, not particularly where I am. It's just within the NHS.
It's okay,
Yeah.
you can say it. We know your trainers here, but you can say it.
I'm actually very happy where I am. But,
Yeah. But he just doesn't know why he's there. Yeah.
Yeah, no, I think it's morale. I think within the organisation, like for example, when we were having that talk then about the housing,
Yes.
I was based at North Manchester, and North Manchester just sold a massive plot of land to a developer who's put like 300 houses on it, and then you've got all these staff that are struggling to house people.
Yeah.
Selling staff land for private developers,
Yeah.
so it just sort of makes you think, well,
Well, I think.
creating a problem and then.
I think, yeah, definitely. If you're asking the question about why is the NHS here, I think we better stop now, because I'll certainly be dragging my soapbox out. But from a team perspective, I'm just, yeah.
In my GP practice, I feel like, as I'm an ST3 and I've kind of done one of my exams and I've been there for 6 months now, so I kind of feel I've moved up those, maybe down to performing now, where I'm trying
Great.
to perform what my role is, because yes, we had the niceties and who's got their own little individual roles, what they're doing, and who does what well, but now we're just trying to perform.
Yeah.
Because I don't feel like I can flourish, because any new ideas and things like that I'm trying to put out there, it's about the partners maybe accepting that,
Yeah.
and then enacting on those and implementing those practices that you might want to, or those ideas that you give.
Yeah.
But I feel like at the moment, I personally feel that I'm performing because they allow me to perform as well as I feel like I can.
Yeah. But you kind of not bought into the vision, because you're not going to be staying
Exactly,
there. Yeah.
I'm not there for the long haul.
Yeah. Sorry.
I'm just wondering, when you do like quality improvement project and activity and things like this, would you not think you are exceeding at what you guys
See,
do?
I came from a practice where everything seemed to be, it was like a well-oiled machine, and then I took some of those and brought it to here and said, by the way, we could do this and this and this, and it just sort of like I think there's like 8 partners, so it was just like we've heard this, and it's like, okay, yes, you're right, we should, and then all of a sudden it just like dissipates.
Yeah.
So it's because you're kind of set in your ways for such a long time. The 2 older partners there have been there for just under 30 years, so they're the senior partners, and obviously everything has to go by them. I'm not saying that they're not willing for change, but I think it's just difficult to try and get that change. So if I'm not there, if I'm not going to be invested to be there for the long haul, I guess I'm not invested to keep pushing if they're not wanting to,
No.
if they're a bit resistant.
I'm going to bring you in, because you're a GP partner. Yeah. So, no, I was just looking at it from a different perspective, because, as the effective leader, how do you use this sort of thing with your team?
I've been in this place for 2 years or so. So I always think if you're going to bring in change, just wait 6 months, just see how the organisation works, and just sort of watch and observe. Because often what you think is the right thing, actually you might be won over by their ways of doing things. So I think always with management change, or if you want to bring in change, just watch first.
Yeah.
And then I think obviously I'm in a practice that we've got about 11,000 patients. Actually, there's been partners leave, and I've ended up in more of a sort of leading the organisation, and we've got, perhaps we're not performing as we should be as a practice.
Okay.
And so yes, I've quickly gone through the polite phase.
Yeah.
I know why we're here, and then the bid for power. Yes, I'm in that place. But I think there is been a historic, the top rung.
Right, the esprit de corps.
In
Okay.
terms of the
Which it
practice.
can do with change, yeah.
But there's still that spirit of team working. And
Good.
That's why I joined that practice. But you may join a practice for different reasons. And
Yeah.
some people might join a practice for other motivations.
Yeah.
So, it depends on what motivates you as well, whether you want that or not.
Yeah.
Because some people work very independently, just go to the job and leave it.
So that's a really interesting point, because when we talk about teams, we tend to think or there is a tendency to think that right, I'm part of this team now, I need to learn to work with my colleagues because we've got X to deliver. But you're right, some people don't even think of being part of a team.
I think GP is really interesting because you're kind of seen as someone who works quite independently and on your own. It can feel a bit like you're independent and on your own. But then, in my experience, working in different practices, you realise how important the team that you're in is, and if that functions well, it can be incredible.
Mm-hmm.
And when it works badly, it's horrendous.
Yeah.
And I think GP is an interesting kind of, it's got that disparity of feeling a bit like you're on your own, but there is teams, and you can create or be part of those teams.
Yeah. Because
that's when people start to maybe isolate themselves. They've come and they've been polite, and maybe they're not, and they know why they're here, but just for themselves, not as a wider, like, I don't know, I've seen certain individuals come straight, do their job, and then gone straight out.
Yeah.
And then there's other individuals who will bring cakes for the team and do other things, and even if it's just for the secretaries or whatever, it's because you know you're working with those teams, with other members of that team, but in a different capacity. Like you said, because you might feel like you're in your own room doing your thing, but you're not going to send it. Who's going to send your referrals for you, and who's chasing up certain things for you?
Yeah.
So you are working in a team. You have to see it like that. Otherwise, you just kind of be polite, go in and do your job and go out.
There is a personality thing, though, isn't there?
Yeah. Absolutely.
Some people really function best kind of working on their own, and I guess that's okay as well. You just have to learn who's different and.
It's okay to an extent, but I think you have to work in it.
You have to work in it.
Accept that you're working in a team.
Yeah, I was just.
You're a product of your environment as well. So I know I come from a very small practice, I've been lots of change, and there are times when even as an individual who wants to work really well as a team with lots of people, if you are overworked and overstretched and only have so many hours in the day, sometimes you turn into that person that maybe you don't want to be when you don't go out. You're really saying, "Hi, how are you? It's nice to see you." So it's recognising that as well.
I think that's a really important point, because particularly when you look at a lot of the psychology, the psychometric models, etc., the impact of stress on the way that we would normally operate. So, I mentioned Myers-Briggs before, somebody with a preference for extroversion, so that person that comes in of a morning and says, they have to say hello to everybody, get their coffee, and then off they go, they're fine. They start to come in and it stops being a coffee and it's, oh, did you see Coronation Street? Like, oh, what did you think of that? And you're thinking, hang on a second. So they're becoming more and more extrovert because they're under stress. And then you notice that person comes in of a morning and it's morning. You get on and they've kind of gone over the edge because that stress has become too much. And I've spent so many times talking to managers, particularly around sickness absence and trying to prevent sickness absence, where they say, I should have seen it, I saw that coming, but I don't know what I saw for me to actually try and do something with. And then it's into the have a little chat with that person. I mean, you could do it as a colleague. You don't have to do it as a manager, or it could be that it starts to present as a real problem, and that's the other side of working with a team. We don't always get on, do we? And I've heard people shout at each other. I've slammed doors, but I've also done a lot of work with people around something called constructive confrontation, which is a really simplistic model, but just for me, I wish I'd been taught that in school, because it just works. Have you come across that model? No? Do you want me to just very, very quickly, because I think if you're busy and you're dealing with somebody who you're having issues with, the tendency is to either, well, I'm going to ignore them, I can't be doing with that, or you'll say something and it comes out completely wrong, because not many of us actually like confronting. Anybody here like confrontation? It's always a little bit, get a bit nervous. And the thing that it was developed in the 1960s of all things by a psychologist called Helen Kleinard in America. But like I say, I think this should be taught in school. And it's called constructive confrontation. And the first step, even if you can only do this before you confront someone, if you can follow the model while you're doing it, it's even better. But even if you can just do this to plan. So the first thing is prepare. Have I got a right to confront? Because you're a little bit quiet and I'm really noisy, really have a right to confront you. I might think I have. Or I'll give you a really good example is you're working alongside someone and you know that they are having an affair with your friend's husband. Yeah. And they are always on their mobile phone. They're always messaging. And so in a work situation now, do you have the right to confront that individual? Not really.
It's impacting work.
How is it impacting work?
You just said they're on their phone all the time.
Right. So that's different. So you're absolutely right. So if it starts to impact, if they're not there because they're always on the phone, regardless of the reason that they're on the phone, the fact is that they are on the phone and therefore maybe some information that you needed, you're not getting because they're never there. And you're absolutely right. Now you've got the right to confront that individual.
Are you the most appropriate person to do that?
Well,
being a friend being the kind
okay.
of the friend of the...
Let's go through the model.
Okay.
And because what we try to think about is removing the person from the problem. So let's tackle the problem because we know we can confront them because they're always on their phone. And the information that I need from them, the information I need from them, I'm not getting. And then it starts to get very American here. But I love this bit. Ask permission. It's not, excuse me, can I confront you about this? It's a little bit, when you finish, can we have a quick cup of coffee? Because one of the scariest things about confrontation is actually keeping hold of our emotions and going into it. So, and they'll say, no, tell me now. And you've got to say, no, it's okay. You finish what you're doing, I'll grab you at lunchtime or whatever. And then eventually you get there and you do another very American thing and you deliver the message. Now this is where hopefully we'll address the point that you've just raised there. And the first thing you talk about is behaviour. So the actual thing, not a feeling that you've got about, don't like, you're awful quiet. It's not going to get us anywhere, is it? But it's the behaviour. And then you talk about, the effect that behaviour has had on you. Otherwise, you've got no right to confront. If it's not, or if you're a team leader, you might have to do it because you're intervening on someone else's behalf. And then you talk about feelings. And feelings at this level are primary. So you might feel utter contempt and loathing for this person who's having an affair with your friend's husband. But you talk about disappointment, anger, upset, frustration. So the example would be, this morning, I asked you to give me the information about patient XYZ because they were coming in at 10 o'clock. Yeah. You were on your phone, and but you were on your mobile phone. Okay, let's just leave it at that. Doesn't matter why. So that's the behaviour. The effect was I then didn't have that information. The patient had to wait 5 minutes. She was extremely distressed. And it took us much longer to try and sort that situation out, which makes me feel a bit frustrated, annoyed, upset, let down, disappointed. haven't talked about the affair. You don't need to, because the only thing that's impacting you was the behaviour. And then what do you think you do when you've delivered the message? As I say, I've used this model so many times to prepare for confrontation. And that is the bit, it's then you've said your message, shut up. And the number of times that people have said, I'm sorry, I didn't realise that my behaviour was affecting you that way. And if they're telling lies or not, it doesn't matter. If they stop it, whew, end of problem. If they say, oh, no, I didn't. No, I didn't. You got all that information. Never repeat their behaviour, because if you go back and start talking about behaviour, it's yesterday and the day before and at 2 o'clock on Friday, I know you're on your phone, and it starts to become, even though you know that's right, but I did not have that information at 10 o'clock for the patient. And, you know, it really is frustrating. Might never get anywhere, because these sort of models do assume that you're dealing with a rational, reasonable human being, which we're not all. But the good thing about it is that you know you have done your best. You've done your best. You might have to, well, we'll go away and we'll talk about it another time. If it keeps happening, then it's, look, we had this discussion last week. I told you my perspective, and you're still on your mobile phone instead of giving me the information that I need. Blah, blah, blah.
Is there any kind of ending to it?
Very often the ending is, I'm sorry, I didn't realise it was happening, I won't do it again. And they go off and maybe don't talk to you for a while. And they might not stop. And they maybe don't stop the behaviour completely. So she's always on her mobile phone to this fella, but she'll never do it and not let you get your information again.
My wife's on the other side of the room.
Oh, you wait till you get home. You wait. Just do it one at a time, will you?
Do you work together as well?
Yeah. But as I say, the number of times, even just to use it to prepare, it's been really helpful. And as I say, the number of times I've got to that stage, and fortunately, the issue that I've had has stopped. It might recur, but then I can go back to that. So we've got to stop now. So Helen Kleinard. Yeah, 1960s-ish. American.
I think I've listened to a book which is similar to this, if you want to say.
Oh, sorry, I didn't hear what you said.
There's a book I think I've listened to recently that talks about this as well.
Yeah, this was the original, but it's. I once worked for a boss who was quite violent, actually, or could be quite violent, and I remember being backed against the door and saying, "But the effect was, I felt," and then eventually I got out and changed jobs, surprisingly. But what it did, rather than me wanting to hit her or cry, it enabled me to keep in control. Which I think, when you're confronting someone and you have difficulty with someone, these are the key points. So we're going to be thrown out now. Are there any last questions or observations or points or?
Do you know when you mentioned at the beginning who likes confrontation?
Yeah.
Because if I do, I'm just looking from future perspective. If I do something like this to someone else and then they stop talking to me, that conflict then arises, then, doesn't it, within you and your workplace?
So you've stopped, yeah. So you can use the model again. Look, we had that meeting, blah, blah, blah. I told you my view. You've stopped talking to me, which means now that we're just, the team's broken, or however you want to phrase it. And I'm really upset about that. You can't solve it. But the other thing is, the very, very, very last point is the number of people who say to me, I should have tackled that years ago. And you didn't. And the longer you don't do it, the less able you become, and the more it can drain away. It can be, if managed properly, it can be healthy. Yeah. Anyway, thank you all so much. Thank you. Thanks for joining in, and good luck with your next placements. And I hope you find out why you're here.
I will have it.
You're going to be told now anyway.